I'm told that back pain is the worst possible pain that you can have. Very debilitating, and also, of course, it's with you all the time. One particular gentleman, a gentleman who comes from Israel but has lived in Thailand for many years, had such a problem. He lives in Koh Samui and for whatever reason couldn't get the problem fixed there. Put himself on an aircraft, came to Bangkok, and we have the story today about a gentleman who now walks with no pain and had the most incredible surgery. I'm pleased to welcome firstly the patient, Mr. Erez Lebanon. Hello, thank you for joining us. Also the doctor, the neurosurgeon who actually conducted this particular surgery, which is really, really unique, Dr. Virapan Huangsongtam. Very nice to meet you. Firstly, can we talk about your problem? I mean, did you have the back pain for some time, or you just woke up one day and the pain started getting worse and worse?
Yeah, I just woke up I would say three weeks before the operation with a pain on my backside with no infliction on the leg or something like that, but it was a very sharp pain. And then I got treated for 5 days in Samui, and I wasn't happy. So I just flew to Bangkok. At the time that I fly to Bangkok, actually I couldn't walk.
So you
I came
in
on a wheelchair. Yeah. I mean, I could, but it was so painful that it was preventing me from walking. And I come directly to the hospital.
To Bambangrad?
Yeah. And then I have an appointment with Dr. Virapan. And before that I got a treatment for the pain and admitted to the hospital, and then I was being explained about the procedure. After checking me out and diagnosed without the MRI and the X-ray, like a first diagnosis, which happened to be exactly what I had later on when the MRI and the X-ray result came. And then the doctor showed me the procedure, explained me about the procedure, a little bit about his background, and showed me some videos on the screen. And I was very impressed. And I think it took me 30 minutes to decide to have the operation or something like that.
Dr. Virapan probably said, "Are you sure?"
Actually, I offered him two choices. Because the pain was severe, but the period that he has been suffering from the pain is not that long. Not long. So we can do the local steroid injection to the area of the herniated disc.
So he had a problem with L4 and L5.
Yeah, to reduce the pain. But his case from the MRI, it shows the big herniation, which in my experience, after injection and the effect will last for 3 months, but he will have the pain back maybe even before 3 months because of the big herniation. So I offered him that I can do injection for you or endoscopic surgery, but I have to tell him that with injection, the chance to end up with surgery is there. I give him 50-50 something. So and he's well educated, so I let him decide by himself.
I understand that when he actually finished talking with you and you asked him, "Are you sure?" he then went to his room, he booked into the hospital, and then he went onto the internet to check you out.
Yes,
is that correct? Tell us more.
I checked Dr. Virapan, I checked the Bambangrad procedures, and I checked also some other doctors that I had doing more or less the same procedure in Israel and other places. And not to my surprise, the procedure is the most advanced and modern in here, in Bambangrad.
Now, you actually were operated on on one day, and then you woke up after the operation, which was, how long was the operation? 40 minutes?
About 40 minutes.
I know minimally invasive means minimally invasive, but actually when you get inside with the endoscope, you have to move things around, don't you?
Yes, I think we call the post-operative pain. The pain from the wound or from the surgery comes from the cutting of the muscle. When you have to go inside the spinal canal to get to the nerves, you have to cut and divide the muscle from the bone, the muscle attached to the bone. So that's where the pain comes from. So with the endoscope, smaller than my little finger, 7.9 millimeters in diameter. So we cut only the skin, and then we use the blunt dilator with the blunt tip, spread the muscle fiber. So I don't cut the muscle, and that is for the lumbar, for the lower back, and for the neck.
Yeah, for here.
Yeah, we can do right now. We just got the first set from Germany. Yeah, I think it's the only one in Asia right now. So we do with the even smaller scope, 6 millimeters. For the back it is 8. This is 6. So we remove the disc from the cervical, disc herniation.
Through this minimal invasive surgery?
Yes, from the back and from the front, there are 2 approaches. Yeah, we are able to do that as well, but not the spondylosis of the neck, but the disc.
Not yet?
Yes, but for the back, spondylosis and the disc herniation both.
You were amazed, and then 2 days later you left the hospital?
Yeah.
No pain?
Walking,
which you weren't before. So this gentleman is yours.
I think I admit you 24 hours, right?
Yes, you admitted to 24 hours, but I say another day for I don't remember the reason.
To recover for himself.
Yeah, for
over
recover
the shock
myself,
of getting no pain.
To make sure that everything is all right.
Normally we admit patient 12 to 24
hours. People with problems to the discs of the spine are those that can be assisted with this surgery. Is that correct?
Yes, with the endoscope, we are now capable of doing all kind of disc herniation. And the second step that we made since last 2 years is to deal with the spondylosis. Spondylosis means you have the degenerative change, the bone and the facet joint get bigger and compress the nerve instead of the disc compress the nerve. So you have to cut the bone under the endoscope. We use the drill to drill the bone.
Incredible surgery.
And the time of the surgery will be a little bit more, but the 1 day admission is same. Yeah.
You knew of Bumrungrad Hospital before because you've lived in Thailand for what, 9 years?
Yes, I did.
Did they live up to your expectations?
Absolutely, above that.
Why above?
Because it's the confidence in the procedure, the confidence in the doctor, the service around, and the other thing that I might say that when I come to the hospital, I know that I get my value for the money. Unlike other hospitals, when I get the bill, I don't like what I see. And here, when you get the treatment, you pay, but you know that the treatment is the best ever. And the thing that I really appreciate the hospital is the how do you say it? When you are admitted to the hospital, when you meet the doctor, the first observation, the first diagnosis, to my experience, it's the right one.
I think that's very, very important.
Yeah, that's the most important, because after you have the right diagnosis, the rest is more or less known. So the doctor is good, the best, whatever. But once you have the right diagnosis, everything else is...
So you're working on losing that 10 kilos, and then Dr. Veerapan will be happier?
No, I will be happy because I'll drive my motorbike.
Dr. Veerapan, thank you very much for joining us, and also advising us both here in Thailand and internationally about the particular surgery that's available here. And by a chance meeting with Dr. Sebastian, yes, you were able to bring that special expertise here. Again, thank you, gentlemen, very much, and good luck for your health in the future.
Thank you.
Thank you.